Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservy. It's Medical Monday at East Cooper Medical Center, and today we're learning how robotic technology is changing the surgical process for both doctors and patients alike.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Melanie Blome. She's with Low Country OBGYN. Thanks for having us today.
Thank you.
Okay, so we're talking about some cool stuff, cool technology here. We're talking about robotic surgery using the Da Vinci robot, right?
Yes, that's a surgical platform that we use here.
Okay, so what is it?
So the Da Vinci robot, it is a technology that allows us to do very complex surgery through small incisions. The robot itself, it has one part that has 4 different arms on it, and that goes on top of the patient during the surgery and connects to the patient. And the console, which is right next to the patient in the operating room, is where the surgeon sits and controls the robot arms.
So is it like a video game?
Kind of like a video game.
Okay.
Yeah.
And so in your profession, what do you use it for? Because it's used in other areas, like medical areas, correct?
Absolutely. A lot of different surgeons use the robot for various types of procedures. Specifically, I use it more for hysterectomy, so removing uteruses, removing fibroid tumors, or
because you can have some major scars from that normally, right?
Right. And our goal is to, the robot isn't necessary for absolutely every procedure, but we can do procedures that used to be done through an open, larger incision, through much smaller holes.
So do you have to have extra training for this, I'm assuming?
Yes, the training for the robot, there's a lot of phases to it. So there's videos and lectures, simulations on the robot trainer, as well as you have to watch several cases and then have someone proctor while you do the surgeries before you can start doing them independently.
Do you like using that?
I do like using that.
Yeah, you do. Yep. I love it. Okay, so what are some of the advantages? You talked about this, like the scarring and things like that. The downtime probably is another one of them, right?
Yes. The healing time for a minimally invasive surgery is going to be much less than a large incision. The pain is significantly less.
The risk for infection probably, right?
Infection, exactly. And we can just do much more complex surgery for big uteruses or big fibroids that we couldn't do in the past before the robot.
Because normally that would have put them down for the count for a while, right?
Yeah.
Get them back up and running. Okay, is there anything else we need to know before we head out?
I think that's it.
No, I think that's it. All right. Well, thanks again for having us. And for more information, head online to eastcoopermedctr.com.